What is up, everybody? This is Dr. Shirla, Director of Aesthetic Surgery for Northwestern Specialists in Plastic Surgery. Appropriately masked, socially distanced, pandemic version of...
How many feet apart are we?
Not enough. That's why we're wearing the masks. We can't social distance. You know, we're doing this for you.
Right.
To help educate. That is our most important mission, education. We love doing that here.
And patient safety.
Yeah. An educated patient is a great patient. And today we're talking about chin liposuction. Liposuction to the chin, specifically, more technically correctly, the submental region. In this area here that most people affectionately refer to as their double chin. And this is something that, you know, we've kind of always done, but really a couple of years ago, I performed this procedure on one of our own staff, and it ended up being a social media post on our Instagram. Make sure to follow us on Instagram for fun posts like that. And it blew up. It just it became like, I'm doing 3 or 4 of these a week now. It's insane.
It's kind of crazy.
It's all I do.
Yeah.
We are chin lipo.
He has a PhD.
In chin lipo. Fun fact. Harvard University.
Yeah, I think the reason for all of these chin liposuctions is because everyone is on a Zoom call and
so true.
Not the right angle.
It's so true. You would think. So I think there's a couple of, you think we're wearing masks. So who cares? Why would anyone care about this area? But you're right. Many people, because you're working from home, you're on these Zoom conferences. These are video conferences. Most people don't have a nice studio lighting setup to make them look as good as possible. And so that's really going to accentuate the double chin. You know, if you're looking down, if you're on this laptop, you're looking down a little bit. Bad lighting, bad angle. Not good. And so many people are very self-conscious about it.
Yeah.
Mix that with the fact that they do have some downtime. You know, most people are working a little bit less right now, so they do have some downtime to recover. And when they are recovering, if we do cause some bruising, they get to wear a mask most of the time. So it all kind of goes together. And but you're absolutely right. We've been seeing a huge explosion in interest in this recently. Even, you know, you're our newest physician assistant.
I know.
You've already seen us do several of these, you know, at least one a week during the time that you've been here.
1 or 2 a week.
What's your experience of the whole process for patients from kind of start to finish consultation?
So, you know, the consultation, I feel like there are several questions that most of our patients do like to ask. One big question is, you know, how is their skin going to look after the chin liposuction? We are removing fat and it's physically going away. So now we're left with this empty space. So what's going to happen to that skin?
Well, when you do the procedure, liposuction in general is a stimulating procedure. It does stimulate a wound healing response in most people. And so we're trying to kind of really stimulate the undersurface of the skin. That leads to a wound healing response, which we know creates new collagen. And it really depends. It's going to vary from person to person. Someone young, healthy, with great skin, it's going to tend to tighten up, retract like a rubber band, and they're going to have no issues. As you get older, or if the skin's a little bit looser, then they may end up with a little loose skin. And, you know, the good news is we can often follow up this procedure with one of our non-surgical skin tightening treatments. One of the really new, exciting ones that we have seen some incredible results from is the Profound RF treatment, Profound radiofrequency treatment. Make sure to check out the link above for more information about that. But yeah, that combination, it's I like to call that the everything but the neck lift. You know, most people these days are not necessarily up for the downtime and investment of a full-on surgical neck lift, but they can definitely benefit from a little bit of contouring from the lipo and a little bit of skin tightening from the Profound. Really, really powerful combination.
Absolutely. And I think, you know, another question that people like to ask is, you know, are we going to get rid of the jowls that form, you know, as we get older? Gravity takes a toll on our skin. That, you know, triangle of youth flips with time, creating those jowls. And, you know, that's definitely something that Dr. Shirla likes to focus on as well during the chin
Totally.
liposuction.
You know, the whole procedure happens in the office. We numb the area up and we perform the entire procedure through one incision. There's one little poke. It's a mosquito bite that's right below your chin right here, not an area that you can't even see on me or her right now, well, because we're wearing masks. But even if we weren't wearing masks, at a normal conversational angle, you really don't see this spot. And it's just a single spot, but that really does allow us to actually sneak above the jawline a little bit. And we can, to your point, hit the lower face, lower cheek, jowls. So this entire area is in play. And we do customize the procedure to every patient. Every patient has different goals. We saw a patient just yesterday who actually really liked the shape of her face, liked her cheeks.
Right.
And so even though she did have a little fullness here, she was not interested in that. And so we don't have to go there.
Absolutely.
And we can just focus on the double chin. So we really do take the time to understand every patient's unique anatomy, their unique goals.
Right.
And I always tell patients, you know, for this to work, I need to know what's in your head. You need to know what I'm capable of. If I'm capable of what's in your head, then we can work together and great things are going to happen.
Right. That's a wonderful relationship that we want, right?
There you go.
So another thing during the consultations that I, hear a lot about is the recovery period. And I tend to tell everybody, you are going to be swollen. We're going to blow you up like a bullfrog and you're going to have some swelling. It could last about a week or two. Typically we wrap everyone with an ACE wrap that we recommend and encourage patients to wear around the clock for the first few days. And then, we recommend that after that, it's just to the patient's comfort. If it feels good, wear it. If it doesn't, take it off.
Yep.
And then we tend to see everybody pretty often after all of our in-office procedures. How often would you say we see patients after?
At least, once in the first week or two to make sure everything's okay. And then it takes a couple months to see how things turn out. But we usually see people at least at 1 month, 2 months, 3 months.
Right.
We want to track their progress.
Right.
I think it is important for people to understand, in our experience, we've done, hundreds of these at this point. We have seen quite a bit of variability in terms of how long the swelling can last. And
absolutely.
we do have some patients that are maybe a little bit more frustrated because the swelling seems to last a little bit longer. We can do some things to work with that in terms of massage, wearing the compression. The average patient, I would say, is going to already see pretty great results after just a few days or a week or so. But yeah, there's always exceptions. It is surgery, and surgery has some degree of unpredictability.
Absolutely.
We work very hard to minimize that and optimize everyone's recovery. But people do need to understand that this is the real deal. This is not just a skin treatment. We are actually doing surgery, and that's why you want to do your homework and come to a place like us where we've done the research and we have the experience and technology to really give you the best results.
Totally. What is your favorite song to listen to while you perform liposuction?
Oh my gosh, in general, this is going to come from a little anything that's 120 BPM or higher. You got to have that rhythm to kind of keep things.
Oh, beats per minute.
Yes, exactly. That's sort of my background as a former DJ back in my years off after college. So yeah, it's upbeat, high tempo. That's going to keep the energy going. Skrillex, guys, do people even remember Skrillex? That's old. You're showing your age. Dubstep, is dubstep even a thing?
I don't. House music is.
You just saw Deadpool, right? Is dubstep still popular?
I don't know about that, but. Anyway.
But yeah, in general, upbeat music. We do have music playing in the room. We do this as an office procedure, so patients are awake. And to be frank, I typically will play whatever they want. It's really not about me, it's about them. And we want to help them to relax. I like all kinds of music. I have a lot of very wide-ranging interests and tastes. And it's actually kind of interesting to me to see what my patients ask for. And I have listened to everything from country to hip-hop to Christian rock to Tibetan throat music. I'm not making that up. Tibetan throat music. It's amazing. Look it up. What is that? Look it up. Maybe we'll have a link.
Enjoy,
great.
You're welcome.
Yeah. It's very soothing. It's like kind of zen.
Yeah.
Anything else?
I think that's it. Do you have any questions?
It's chin lipo. It seems pretty straightforward, but it is.
It's an art.
It's an easy procedure, and that's why you can do it in the office. But the results are astounding, and in the right patient, it can really create a dramatic improvement without looking weird. It looks like it can look like you lost 10 pounds, and you still look like yourself. Quick, easy recovery, very satisfying to do. Very, very fun procedure.
Absolutely.
Make sure you click subscribe and that notification bell to be notified when we drop future videos like this. Hopefully you found this helpful. If you have any other questions about chin lipo, make sure to leave a comment below. Thanks for joining us today.
Thank you.
And have a great day. Stay safe.
Was that good?
You crushed it.
We crushed it.
Killing it. We're going to have our own talk show.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.